Hi, my name is Ryan Bates. I will be the nurse practitioner student performing an abdominal exam on you today. How are you feeling?
I'm feeling good, thank you.
Let's start with inspection. I'll have you pull your shirt up for me so we can take a look. First thing I notice is that your abdomen is symmetric. Your umbilicus is midline. I see aortic pulsations, but I do not see visible peristalsis. I don't see any scabs, lesions, scars, striae, or bruising. I also don't see any dilated veins, and your abdomen is flat. What we'll do next is we'll take a listen. We listen before we palpate or percuss on the abdomen because we don't want to create any bowel sounds that we'll listen to later. So first what I'll do is, starting with the diaphragm, the bigger part, I'll listen to your 4 abdominal quadrants for about 15 seconds each to listen for your bowel sounds, okay?
Okay.
So we'll start in the right upper quadrant. Then we'll move to your left upper quadrant. Your left lower quadrant. And your right lower quadrant. Now, while I still have the bell turned on, I will listen for any friction rubs over your liver and spleen. That would indicate potential inflammation of those areas. Liver, and then we'll do spleen. All right, and I did not hear any friction rubs over those areas. Next, using the bell, I will listen for any bruise in the arteries you have in your abdomen. I will start with the aorta, which is the largest artery in your body. It is midline below the xiphoid process. Next, I will listen for the renal arteries, which are approximately 1 inch laterally to that same area. And we'll do the left and the right renal arteries. Next, we'll do the iliac arteries, which are approximately 2 inches below the umbilicus on either side. So we'll do the left iliac artery and the right iliac artery. And the last one is the femoral artery. I'm going to put this just below your waistline so we can listen to the left femoral artery and the right femoral artery. All right, that looks good. Next, I'll listen for any venous hums over the epigastric area and the umbilicus. So we'll listen in the epigastric area for any venous hums and directly over the umbilicus. And I didn't hear any venous hums in those areas, which is normal, and I didn't hear any bruise in any of the arteries we listened to, which is good. Normal response, normal findings. Next is going to be percussion. I'm going to percuss all 9 quadrants of your abdomen, okay? I'm going to start with the right hypochondriac. I'm listening for tympani, which is like a hollow sound. And then we'll do the epigastric region, normal, and the left hypochondriac region. Then we'll do the right iliac region, right? The umbilical region, great. The left iliac region, right? The those were the right lumbar, umbilical, left lumbar. Now we're doing the right iliac region, the hypogastric region, and the left iliac region. Next, we're going to percuss a few other things, starting with your liver. Next, this will actually kind of measure the size of your liver. So what I'm going to do to start with is I'm going to percuss down from right under your nipple until I hit a dullness. This is resonance, which is your chest, and then we'll listen for dullness, and then I will come up and listen for that same dullness from a change in your normal abdomen sound, and we'll measure that distance to get an approximate span of your liver. So I'm going to begin by percussing up. There's that. And then I will begin progressing towards that spot. Alright, we hit another dullness again. And then we're going to measure that. And it looks like your approximate liver span is 5 centimeters, which is normal. We want really anywhere between that and 12 centimeters. Next is going to be your spleen. I'm going to have you I'm going to percuss over your spleen. Listening, really all I want to hear is tympany or resonance. And that is what I hear. Awesome. Next, we're going to do palpation. I'm going to start with a light palpation, where I just take one finger and I lightly go around your entire abdomen, feeling for any hard spots, any areas of tenderness for you, any areas of warmth, any abnormal bulging, any pain with that.
No.
Next is the deep palpation. I'm going to take both hands. I'm going to have to compress a little bit farther. It might be a little ticklish. My best recommendation is just to relax and feel if there are any deep underlying issues, okay? So I'm going to start in the middle. Or actually, I'm going to start off the side. I'm actually going to avoid the middle area because I don't want to compress your aorta. I'm going to go about 2 to 3 inches. You're doing great. I know, I'm ticklish too. All right, great. Did that have any tenderness?
No.
All right, great. So next what we're going to do is we're going to do palpation of the liver edge. So I know that your span of your liver is right about here. So I'm going to find the edge. I'm actually going to take my other hand. I'm going to help bring it forward, and then I'm going to try and palpate the edge. What I want is for it to feel firm, smooth, and you're not having any tenderness, are you?
No.
All right, that's normal. While we're doing this, I'm going to check for Murphy's sign, which is a sign we can use to measure, or to kind of guess for cholecystitis, which is gallbladder inflammation. I'm going to do the same thing, but I'm going to be pressing deeply, and I want you to inhale. If there's any pain, it will be relieved on inspiration, which is inhalation. Any pain?
No.
Okay, good. Negative Murphy sign. Next, what we're going to do is I'm going to palpate for your spleen. Really, I'm going to have to press kind of hard. I normally shouldn't find it. People who have infectious mononucleosis might have an enlarged spleen. Any blood disorders could potentially happen. I didn't feel your spleen, which is good. We're going to go to the kidneys now. I've been doing the biomanual the whole time just to help get a good grasp on it. I'm going to be pulling up and then pressing down at the same time, trying to feel for any structure that might feel like your kidney. Normally you can't palpate them. If you can, it's usually on the right side. I can't. Any pain or anything?
No.
All right, great. Next, what we're going to do is I'm going to have you sit up, and we're going to test for costovertebral angle tenderness. If you were to have any, like a kidney stone, pyelonephritis, any issues with your kidneys where they might be inflamed, simply tapping on your back right here, it's probably going to make you jump off the table. But what we test for is a light thud, kind of like this, and the costovertebral angle, which is where the bottom of your ribs meet your spine, okay? So we'll test the left side first. Any pain?
No.
All right, and then the right side. Any pain?
No.
All right, great. You can go ahead and have a seat now. Relax again. And as we mentioned earlier, we didn't hear any dullness on percussion of the abdomen. If we did hear dullness, that could be a potential sign of fluid buildup, which is called ascites. But we heard tympany throughout, which is a good sign. Next, we're going to do a couple tests that might help us diagnose or help give us signs that you might have appendicitis. First one's called the Rosving sign. Your appendix is in your right lower quadrant, which is where you would normally have pain. Some people have pain when you press on the left side, okay? So I'm going to go ahead and press on the left lower quadrant, and you tell me if you have any pain on your right lower quadrant over here.
No.
Good, that's a negative Rosving sign. Next, the two next ones we're going to use are going to manipulate the muscles that kind of surround that part of your abdomen. Any manipulation of those muscles could cause a further irritation of that tissue, which is going to elicit a painful response and give us an idea of what's going on right there. This one is called the psoas sign. I'm going to have you lift your leg up and go ahead and press down against me. Great job. Any pain in that right lower quadrant?
No.
Great. That's a negative psoas sign. Next one is the obturator sign. I'm going to have you lift your leg up again, and I'm going to manipulate it with an inward rotation. Any pain in that right lower quadrant?
No.
Awesome. That's a negative obturator sign. Everything sounded pretty good to me. Do you have any questions?
No.
Alrighty. Thank you very much.
Thank you.